Welcome back to the Taiwan Outlook. We'll continue our discussion with Dr. Andrew Huang, President and CEO of the Koo Foundation, Yat-Sen Cancer Center in Taipei, Taiwan. Dr. Huang, in this segment, I want to ask you at the beginning, would you care to share with our viewers back home your notion, the notion that you've been advocating, the importance of managed care versus managed cost in terms of highlighting the quality of medical care that's provided to patients?
I think for a patient,
yes,
he or she really care about whether the best
illness,
care is being delivered,
yes,
whether the illness he or she can recover from the illness.
Mm-hmm.
They don't really need to know whether you are an internist or you're a surgeon or you're expert in this field, in the heart, the treatment of heart, or in treatment of kidney, and so on and so forth. What they want to do is to make sure that they recover from their illnesses, the best they can.
Mm-hmm.
So, for a modern hospital,
of course,
there's really very little point in dividing up a hospital according to specialty.
Okay.
Because, for example, I'm in cancer treatment.
Yes.
So when a patient comes with breast cancer,
yes,
first of all, you need to have a diagnosis made,
yes,
whether the person does have breast cancer or not.
Yes. Mm-hmm.
And that requires some imaging, radiologic imaging,
yes,
technique.
Mm.
And once they detect a certain lesion, then there's a need to know whether that is cancer or not.
Mm-hmm.
So a biopsy will be taken.
Of course.
The pathologist will then look at the biopsy specimen,
okay,
and tell the clinician that this is definitely cancer.
Okay.
And what kind of cancer, how aggressive
the cancer cells are, yes.
And then clinicians can assemble and then recommend the best treatment for that stage of illness, that kind of illness. And with all these, you also need people who are going to care about their emotion, their family situation,
state of mind, yes,
and whether they can cope with their treatment or not,
yes,
and to help bring them through treatment. And then they need to be followed. So for treatment of breast cancer, you require a multitude of specialists. So a good hospital management of modern times is the emphasis of patient at the center.
Okay, yes.
In our hospital, we even have so-called care managers.
Okay.
These are usually senior nurses.
Okay. And
they embrace the patient.
That's right.
They make sure that the patient feels positively about the treatment, and of course with all these side effects that are going to come up with treatment, which is inevitable.
Yes.
These care managers will help them deal with it.
Yeah.
The psychologists, psychiatrists will help them.
Of course.
And so throughout the entire course of treatment, there's a need to guarantee that they come out successfully. Okay. And so the hospital should not be divided according to the traditional concept of the departments. But one may say, well, then should we abolish departments? And I'd say perhaps not yet.
Okay.
Because for a surgeon to become really solid, you need a good training program. So the traditional department can handle the training, can handle the education, can deal with the accreditation requirements of the government, or whatever, in Taiwan would be government. So the classical, traditional departments ought to be kept for now, until one day when we know how to do this thing better. So this will then prevent the formation of silos. Okay. See, currently, for you to be able to do something with the surgeons, you have to talk to the chief.
That's right.
And the chief will say, okay, we approve, so we'll get someone to help you.
Yes.
But in the modern hospital, because they're all formed in a multidisciplinary team manner, you don't need to go through that process.
Okay.
So they are collaboratively working together.
Yes.
So any new hospital ought to be designed to enhance collaborations of different specialty people.
Okay.
That's very important.
Yeah, of course.
And also in Taiwan, there's a major problem, and that is practically every hospital pays its physician by the number of patients they see.
Okay.
And they call it PPF here,
Okay.
or professional fee structure.
Okay.
This is absolutely wrong, I think,
Okay.
because if you think about seeing 100 patients, my pay will be better than seeing 50.
Yes.
I definitely will see 100.
That's right. There's that incentive.
But I think that's already too many.
Mm-hmm.
In our hospital, our experiment has worked.
Okay.
They see fewer patients, spending more time with each patient, and the patients get better.
Of course, quickly.
And
yes.
they're still paid decently
Yes. Yeah.
as compared to other hospitals.
Yeah.
So we don't really need to pay physicians like the way we pay insurance brokers.
Yeah. Okay.
Physicians are not insurance brokers.
Yeah. And I don't believe that medical professionals are in the profession purely for the sake of money. There's also that mission or that drive to save lives, to make people's quality of life a little better. And by listening to you, Dr. Huang, I can't help but remember a Hollywood movie that came up about 15, 16 years ago. Simply the title is called Doctor. I don't know if you've seen that movie before. Yes, but of course, the movie itself might be a little more dramatic in terms of how the outstanding doctor, got sick himself, and then he had the taste on the other side of the table, and found out that maybe the way he was delivering medical practices in the past were not compassionate enough. Would that still be the case that you see today in Taiwan, or do you see improvements? Whether that is the accurate depiction of what's happening in the medical profession.
Unfortunately,
today?
What you just described is correct.
Oh, really?
There's a long way to go for Taiwan.
Okay.
The most hospitals are really not patient-centered.
Okay. All right.
They're not designed to be outcome-based.
Okay.
You see, we measure our hospital's performance constantly. We have a prospective database. So I can tell you right this moment how well we fared in the treatment of breast cancer, in the treatment of colon cancer, in the treatment of lung cancer. I can tell you that because we measure. And then if we see a decline of survival of these patients, we know that we've got to do something to change that. So we're constantly monitoring our results. And so our value is measured by how well we help our patients rather than how much money we make. So I frequently say that the bottom line of our hospital's accounting book is not money. Is the recovery of health of our patients.
Of course. And for those of you watching this program at home, you probably don't know this, but the hospital that Dr. Huang works at, the Koo Foundation Yat-Sen Cancer Center, is a small hospital in Taiwan by other standards. But the fact of the matter is that the kind of quality of medical care provided at the hospital is highly regarded in Taiwan. And we were just talking before the program started that you have less than 200 beds, but in terms of breast cancer treatment, you have more patients than some of the other leading much larger hospitals in Taiwan.
Correct. We take care of about 10% of our population with cancer.
Oh, that's very good. And also you mentioned that in addition to clinical work, you also do education and also do research. And I know your hospital is one of the leading cancer hospital in Taiwan, center in Taiwan. And would you, for the remainder of the program, would you tell us a little more about the kinds of work that you are leading at the hospital and the kind of breakthrough that you would like to see in the coming future?
Well, because of this multidisciplinary approach to cancer, we are way ahead in, for example, in the outcome of breast cancer. We really do well in many areas. For example, we are really good at the treatment of nasopharyngeal cancer,
Yes.
which is an indigenous illness for Taiwan and South China. We are strong in prostate cancer,
Okay.
which is a male
Of course.
disease.
Yeah.
And we are strong in liver cancer and colorectal cancer.
Okay.
We
Those are some
have
of the leading
introduced
causes. Yes.
we have introduced new surgical treatments for lung cancer.
Okay.
And so instead of invading the entire chest, we actually use minimally invasive surgery
Localized,
approach,
yes. Yeah.
so that the patients don't need to stay in the hospital very long.
Yes.
So we are moving in the direction toward
Better care for all the patients.
shorter hospitalization,
Stay, yes.
but with better outcome.
Yes. Thank you very much, Dr. Huang, to be on the Taiwan Outlook today. I certainly enjoyed, as everybody back home, your conversation. I hope your concept of better quality medical care in Taiwan will become a reality very, very soon. And thank you for watching our program. I'll see you next time on Macroview Television. Thank you. Thank you, Doctor.
Thank you very much.